Knock, knock, knock. Should I privacy? Wash my hands. Hello, my name is Anna and I'm going to be your nurse today. Can you please tell me your full name and date of birth? I've got a wristband, everything matches. Alright, Francis. So today, the doctor has ordered potassium chloride to be given right away to help with your dizziness and your weakness. And then you had said that you had some pain, so we are going to give you morphine. And then you also have your dressing change that we're going to be doing today. So, looks like you have your normal saline running, which according to the drug book is compatible with potassium chloride. So we can run those both together. So first I'm going to wash my hands again and apply gloves. And then I'm just going to take a look at your IV site. Let me know if anything hurts as I'm pushing around. And I'm just going to look for redness, bruising, drainage, any swelling, anything like that, which I'm not seeing. So I'm going to remove my gloves and wash my hands. I'm going to get your potassium chloride, make sure that there's no holes in it. It's not cloudy or anything, and it's not expired because the expiration date is 6/2035. So I'm going to do my checks. Francis Christensen, allergic to betadine and codeine, potassium chloride, 10 milliequivalents in 100 milliliters IV piggyback. And then we looked in our drug book, and a safe rate to give it is 100 milliliters per hour. So that's what's going to be running at. Francis Christensen, allergic to betadine and codeine, potassium chloride, 10 milliequivalents in 100 milliliters IV piggyback, given right now. And we're going to give 100 milliliters per hour. Francis Christensen, allergic to betadine and codeine, potassium chloride, 10 milliequivalents in 100 milliliters IV piggyback, given now, and we're going to give it at a rate of 100 milliliters per hour. So Francis, there are some side effects with this medication, such as abdominal pain, nausea, vomiting, and diarrhea. So please let us know if you start to experience any of those symptoms so we can get you something to help with that. So I'm going to get out my tubing. And I'm just going to make sure that there's no kinks. My clamps are closed. Everything looks good. So that off. And that off. That wouldn't actually happen because this bag would have been new. Okay. Alcohol wipe. Clean the part. On the back float to get all the air out. Up there, and then we're going to program the pump. Okay. So channel select, secondary, and potassium chloride is not in here, so we're going to have to set up. We're going to give it at a rate of 100. Come on. Liters per hour. Volume to be infused, 100. And then I'm going to hit start. I'm going to open up this clamp. And I'm going to make sure that it's pulling out of here now. So I'm going to watch for the drops. Okay, so it's pulling out of this one instead of this one. And I'm just going to keep monitoring her for signs and symptoms as I'm doing my other things that I need to do. So next, I'm going to give you your morphine for your pain. I did my calculations already, and the doctor has ordered 2 milligrams, so we're going to give 0.4 milliliters. So I'm going to check my medication. Morphine, 2 milligrams IV push every hour for pain. And she hasn't had it for a few hours yet, so she can have it now. I had already checked her IV site, and there's no signs indicating that there's anything wrong with it. And she has her IV running in it already. I clean this off.
Yeah.
I'm going to let that dry.
Okay, so it's not like when we have to go buy. You don't have to, you could opt to just.
And then this medication, according to the drug book, does not need to be diluted, but we do need to give it over 4 to 5 minutes. And then there are some side effects with this drug, Francis. There's respiratory depression, constipation, dizziness, and nausea. So if you are experiencing any of those, please let us know. And if you do need to get up, please ask us and we will come and assist you. So now that that's dry, right there. Zero 0.4. I'd make sure that I have all my bubbles out, which there is a really big one in there, but I would get that out.
That's it? It's only a failure if you, well, if you did like stuff completely wrong, or if you completely didn't do it.
Okay, so if you want to check it.
I think we did say, did you say at one, was it for the IV roll? Yeah. Did you say every 3 hours? Yeah. Or over 3 hours? Over 3 hours, the correct rate, everything else I just.
Go back the other way.
This way?
Yep.
Keep watching.
Okay. Should be able to see.
Okay. Okay, so now that I am dose accurate, I'm going to do my checks. So Francis Christensen, allergic to betadine and codeine, and we're going to give morphine 2 mgs, which would be 0.4 milliliters, IV push every hour for pain. Francis Christensen, allergic to betadine and codeine, morphine 2 mgs, IV push, which is 0.4 milliliters every hour for pain, or PRN. Francis Christensen, allergic to betadine and codeine, morphine 2 milligrams, which is 0.4 milliliters, IV push every hour for pain, and my medication is not expired. It expires 12 of 2030. So now that that's all good, I would label my syringe with what I have in there, with a label that I pre-made. Alrighty, so, and I did check the drug book, and morphine is compatible with the normal saline and the potassium, so I can give it through her, through the port on the IV tubing. If I wasn't able to give it through the port, I would need flushes. So Francis, just remember, if you start to experience any of those side effects that I had mentioned, you just let us know, okay? Clean that off. This off. Attach it, and then I would give it at my rate of 4 to 5 minutes. But for right now, I'm just gonna give it all. And then I can take it off and then dispose of all of that stuff. And then I'm going to remove my gloves if I had them on and wash my hands. Can't remember. Okay, so Frances, are you feeling okay? She said yes so far. And so now next I'm going to change the dressing on your IV site while I'm still in here. So I'm going to put on my gloves. I'm just going to make sure there's still no pain, and then there's no redness or edema or anything like that that indicates that anything is going wrong with the IV thus far. I'm going to measure her arm circumference 6 inches above the site of insertion. Okay, and then I'm just making sure that's not greater than ½ an inch of what her baseline was, because that would indicate issues with the line, such as infiltration. And then I'm going to measure the part of the catheter that remains out. Okay, so after that, I would remove my gloves and wash my hands again. Alright, so then I am going to do my sterile food, which I'm actually going to do on this side. That's all in the garbage and disposed of. Okay, so I had washed my hands already, and I'm going to give the patient her mask to put on, and if she couldn't wear a mask, I would have her turn her head. I'm going to wash my hands, open up my sterile kit. Okay. And then I would put my mask on and wash my hands, and then I'm going to put clean gloves on first, and I'm going to remove her old dressing. Okay. So that's sticky. Alright, and then I would inspect my dressing and make sure that there's nothing on it, which there isn't. Put that in the garbage. That's all. Okay. And then I would, without touching, inspect my site and make sure that everything looks good, which it does. And then I would remove my old gloves, wash my hands. I can actually do that. Wash my hands, and then I'm going to put on my sterile gloves. So now my hands are sterile. So first I'm going to clean her, clean off if there's any drainage or anything like that on there first, in a circular motion. And then I would let that dry. You'll probably hear my tummy grumbling. And then once that's dry, I would take my tweezers and my ChloraPrep, and then I can stabilize this, and I would scrub vigorously for 30 seconds. And discard of that and wait for it to dry. And then I would take my skin prep and do the border, and then throw that away and wait for that to dry. And then I can place her new dress in it. Oh goodness. Jeez Louise. Here, yes. There we go. Okay. And then I would take this off. And then I'd have my initials, the date, and the gauge of the needle, and I'd place it right on the end. And then I could clean up all of this, remove my gloves, wash my hands, and then I would make sure that my patient, first I have to remove my mask and wash my hands, patient's mask and wash my hands. And then I would make sure that my patient is safe and comfortable, so the bed is lowered, the side rails are up, she has her call light, make sure she doesn't need anything else. And then if she, for an age consideration for my potassium chloride, if she didn't, or if she was younger, she may need a different dose. And then if I was having trouble getting the skin or the bandage off, or if they had fragile skin, I could use a pad to help get that off, so if there wasn't any skin damage. And then I'd make sure I document the date and time that I did everything, what I all did, how much medication I gave, morphine I gave, and then if there's any thing abnormal, like any redness around her area or any adverse side effects or anything like that, make sure that I wash my hands, and then I could leave the room. That's it. That's all.